I'm Evangeline Sino, and today I'm going to discuss the external and internal anatomy of kidney. So the kidneys lies on either side of the spine in the retroperitoneal space between the parietal peritoneum and posterior abdominal wall, well protected by muscles, fat, and ribs. They are roughly the size of your fist, and the male kidney is typically a bit larger than the female kidney. The kidneys are well vascularized, receiving about 25% of the cardiac output at rest. The left kidney is located at about the T12 or the 12th thoracic vertebra to LR vertebra, whereas the right is the lower due to the slight of displacement by the liver. Upper portion of the kidneys are the somewhat protected by 11th and 12th ribs. Each kidney weighs about 125 to 175 grams in males and 115 to 145 grams in females. They are about 11 to 14 centimeters in length, 6 centimeters wide, and 6 centimeters thick, and are directly covered by fibrous capsules composed of dense, irregular connective tissue that helps to hold their shape and protect them. This capsules is covered by a shock-absorbing layer of adipose tissue called the renal fat pad, which in turn is encompassed by a tough renal fascia. The fascia and the lesser extent and the overlying peritoneum serve to firmly anchor the kidneys to the posteriors and the wall in retroperitoneal positions. On the superior aspect or the top of each kidney is the adrenal gland. The adrenal cortex directly influences renal functions through the productions of the hormone aldosterone to stimulate sodium reabsorption. So, kidneys are bilateral organs placed retroperitoneally in the upper left and right abdominal quadrants and are part of the urinary system. Their shape resembles a bean where we can describe the superior and inferior poles, as well as the major convexity pointed laterally and the minor concavity pointed medially. Extern External anatomy is the kidneys are surrounded by three layers. The kidney has three regions: the outer renal cortex, inner renal medulla, and the renal pelvis. So the renal cortex is the dissected kidney. It is easy to identify. The cortex appears slightly in colors compared to the rest of the kidney. The renal cortex is granular due to the presence of nephrons, functional unit of the kidney. Some nephrons are short lobe of Henle does not deep cortex. These nephrons are called the cortical nephrons. About 15% of nephrons have long lobes of Henle that extends deep to the medulla. So the renal cortex is the outer part of the kidney. It contains the glomerulus and convoluted tubules. The renal cortex is surrounded on its outer edges by the renal capsule, a layer of fatty tissues. The main function of cortex is to provide a space for arterioles and venules from the renal artery and veins, as well as the glomerular capillaries to perfuse the nephrons of the kidney. The second is the renal medulla. The medulla consists of multiple pyramidal tissue masses called the renal pyramids. In between the pyramids are spaces called the renal columns through which the blood vessels pass. The tips of the pyramids, called the renal papillae, pointed towards the renal pelvis. There are on average 8 renal pyramids in each kidneys. So, renal medulla is the innermost part of the kidney. The main function of medulla is to regulate the concentration of the urine. Third is the renal pelvis. The renal pelvis leads to the ureter on the outside of the kidney on the inside of the kidney. The renal pelvis branches out into 2 or 3 extensions called the major calyces, which further branch into the minor calyces. The ureters are urine-bearing tubes that exit the kidney empty into the urinary bladder. So, renal pelvis enlarge upper end of the ureter, the tube through which urine flows from the kidney to urinary bladder. Renal pelvis is a large cavity that collects the urine as it's produced. So, the renal cortex receives most of the blood flows. It is mostly concerned with their reabsorption reabsorbing filtered materials, while the medulla is a highly metabolically active area which serves to concentrate the urine. And the renal pelvis is a funnel-shaped reservoir that collects the urine, passes into the ureter for excretion. So blood flows through the kidney or renal circulation. So blood flows to the kidneys through the right and left renal arteries. The renal arteries originate from the abdominal aorta and enter the renal hilα to supply the kidneys. Inside each kidney's base branch the smaller arterioles and penetrate deep into the renal medulla and renal cortex. Blood coming into the kidney is rich in oxygen and nutrients and waste materials. Eventually, the smaller arterioles divided and become renal capillaries where blood gets filtered, metabolic waste are removed to form urine. Renal capillaries are located in and around the nephrons. Fuse form renal veins to leave the kidney. Blood leaving the kidneys veins with have less waste materials as most of the waste materials. The blood renal capillaries they also have less oxygens and nutrients materials are used up by the kidney cells.